Well, welcome to World Kindness Today. Today, we're going to be focusing on good health and well-being, and we have a great panel here today. I have the pleasure of being your host today. My name is Chris Salem. I am an executive coach, corporate trainer, and professional speaker for CRS Group Holdings. And when you think about good health and well-being, what does that definition mean to you? When you look at it, good health and well-being aims at enduring healthy lives at all places for all ages. The UN defines a lot of problems such as maternal mortality, road injuries, communication diseases, reproductive health, pollution, and health coverage in this aspect. So we're going to be talking about achieving universal health through technology. And, the pandemic has changed the course of diagnosis and treatment. However, it's proved that technology and the internet are reliable in health services. And we have a great panel today that we're going to go through and get some valuable insight from their expertise. And we're going to start with the ladies first as we move to the gentlemen. And our first person on the panel is Jordanna Eyre. Jordanna, if you can introduce yourself and tell us what you'll be bringing to the table today.
Hey, Chris, good to be, and everyone else, good to be here. So yeah, I'm Jordanna Eyre. I'm the founder of a company called Sorcerer, and I do personal growth work with leaders. So I help leaders really understand the deeper intrinsic elements of their own humanity so that they lead with authentic power and really understand the humanity of others in the process. I also have a background in social services, domestic violence, child abuse prevention, and addiction. So I've been working in wellness actually literally since I was in the 7th grade. I founded a club of essentially non-clinical counselors in the 7th grade. And ever since then, it's been all about wellness and deeper emotional and mental health.
Well, great. Thank you, Jordanna, for sharing. And Anita Chandra, if you could share who you are and what you'll be sharing today with everyone.
Great. Thanks, Chris. Hi, everyone. My name is Anita Chandra. I work at the RAND Corporation, which is a large research and analysis organization that tries to help decision makers make good choices in terms of the policies that they put in place. I lead a division focused on social and economic well-being, including health and well-being. So I'm really committed to the research that we do in that area. As a background, my background's in public health and child development. So I think a lot about how we can make sure that we are holistically addressing the health and well-being, particularly of children. I also work with communities to think about how do you get these ideas of optimal health and well-being into local policy, into where you put the money, where you put the services, where you put the programs. So I'll be sharing a little bit more from that work.
Thank you so much, Anita, for sharing. And we're going to move to Jeff Spar. Jeff, if you could share with us a little bit about who you are and what you'll be sharing today.
Sure. Hi, everyone. My name is Jeff Spar. I'm a digital transformation consultant and advisor. I work mainly in the arts and culture and healthcare industry. And I really bring a perspective on how technology can influence healthcare and how what we've seen from the pandemic these days, how technology can really help us and change the way we've been dealing with our healthcare.
Great. Thank you so much for sharing, Jeff. And Dr. Carl Clark, if you could share with us a little about yourself and what you'll be sharing with us today.
Yeah, thanks, Christopher. So I'm the president and CEO of the Mental Health Center of Denver. So we provide services to people of all ages, young children to the elderly, and we focus on several things. We focus on what can you do with the body that can help the mind. Sometimes that's medication, sometimes it's transcranial magnetic stimulation, but it's also sleeping right, eating well, and getting exercise, mindful activities. Then we also do all the psychotherapies that help us with the 3 things that our brains mainly do, which is think, feel, and do stuff. And people can have trouble in any one of those areas, and that's what psychotherapy is really about. We include the science of positive psychology. So it's not just what goes wrong with the brain, it's also what goes right with the brain. And then the third thing that we do is we focus on social determinants of health, which actually have a bigger impact on people's overall health status than anything anybody does clinically. So that's having safe and affordable housing, going back to work, going back to school, those things that we all experience that contribute to our well-being, we focus on that with the people that we serve.
Thank you so much, Dr. Clark. Appreciate it. And we're going to get right into the thick of things, and we're going to open up with some questions for the panel. Again, we will leave these open to who would first like to address, and then we'll ask for feedback from everyone else if they'd like to share. The first question, it's a known fact that there are an acute shortage of medical staff all over the world, particularly in underdeveloped countries. This indeed is a big hurdle in achieving a healthy world. Do you think that technology could overcome this challenge that we're facing here?
I can add something. I believe that it absolutely can, as long as it remains in integrity with what humans actually need and how humans operate. And there's a lot being done. I work with a lot of people in technology, and there is a lot being done to humanize technology. And I think it's really just about the caution and the integrity of what we're choosing, what kind of technology we're choosing to integrate in the healthcare industry, that it really stays connected to the practitioners and the people doing the work. And I think that there's another element of vulnerability and transparency. Doctors are notoriously, they don't have time to really consider what's going on inside of themselves. They consider the outside, like the people they're serving. And that causes an imbalance. They don't even know what to ask for. So I think if you add in the combination of healthcare practitioners becoming more self-aware, knowing what to ask for, and the technology staying aligned with that realm of humanity, I think absolutely we can make huge progress there.
Wow. Thank you, Jordanna, for sharing. Jeff, would you like to share?
Yeah, I think that's absolutely true, but I think we have to be careful to avoid, falling too far into where technology takes over the picture for the doctors. I mean, the number of times you go into an office with a doctor these days, and they stand at a computer and a keyboard, and they're looking at the screen rather than the patient, and they're typing things into their medical record system, and they're spending their time really trying to fill out a form or understand how to use the tools and the systems that have been given to them. We really have to find the right balance between our personal interactions with our physicians and the technology that theoretically is there to help the physicians and to help us. And I think that's a very tough line.
Yeah, I think that's something that I'd like. Let's open that up a little bit more. Dr. Clark and Anita, would you like to shed some insight to what Jordanna and Jeff had shared so far?
Sure. So, the pandemic has impacted the well-being of everyone. And I think one of the things that happened in this process was there used to be this idea that if somebody was dealing with a mental illness or a substance use disorder, that was sort of other people. But the impact of the pandemic has been that this affected everybody. And the demand for services has gone off the charts. Like people that had lots of things in place in their lives feeling the impact of this, they're saying, wow, I've been dealing with anxiety and depression. So what do? One of the things is that, especially young people, they can Google depression and they get so much stuff on depression that what they tell us is like, what's the good stuff? Like, I want the good stuff out of this. So one of the things that we can leverage technology with is to curate really good content, because the reality is there's a lot of bad content out in the internet space. So how do we get the good stuff to people? And how do we get the good stuff to people based on who they identify as? Each one of us are different people here. And our approach to depression, if we curate content for each one of us, that it will land more solidly and we'll connect with it better. So one of the things that's happened in our sort of healthcare industry is that the number of folks doing this kind of work has gone down over the past 10 years. In behavioral health alone, the number of providers has decreased 14%, and yet the need has gone way up. And then if we're talking about all over the world, I went to Rwanda, there were 3 psychiatrists for 9 million people. So how do we leverage technology to actually expand our capacity to do work? You know, when do we like use technology to get people connected with good resources and then be there when they're sort of needing guidance around, you know, figuring out what all this information needs? So I will say that access to care during the pandemic for behavioral health alone has gone way up. So I've been a psychiatrist for a long time. I still see people. And when we made that shift to doing telehealth in my clinic, the next day, I saw 100% of the people on my schedule. That had never happened in my entire career. And it was because people didn't have to worry about transportation or childcare or all those sorts of things. That being said, technology works great for some people, and some people still need to be seen face to face. So how do we sort through that and make those kind of decisions about using technology when it works well, and then using more traditional things when we need to?
And I think that's a great combination. Again, you know, using the technology to be more resourceful, and never that it's never going to be perfect for everyone, but nonetheless, if we could find ways that can provide channels that best adapt to how people can identify and use the resources to help themselves. Okay, great.
Yeah, I just want to add, I mean, one of the things that's important with the Sustainable Development Goals is the broader ability to get to diseases early and to monitor chronic disease and mitigate those diseases. So as we think about it in a US context, but really in a global context, we're talking about a lot of the world's population who has access to a mobile phone, in some cases more so than other forms of technology and infrastructure. And so there are, you know, pretty fabulous things that are happening in terms of early detection and early disease warnings. All of the cautions and concerns about making sure that there's not misinformation, that there are other access points for the world's population is critical. But there's a lot of promise here, particularly with mobile technology and health, not just in the US, but broadly.
I think, I mean, closing on that point, I think a great example of that is the sort of the COVID virus monitoring that's been done on mobile phones. I don't know if people have experienced this, but terrific program in the US, and especially I've seen this in New York, where after you got your shots, you know, initially every day, then every week, then every month, you got a text message asking how you felt. Did you have any side effects? Put that in the database. Continuous data collection, continuous monitoring, really done through a mobile phone over the internet. Tremendous amount of data was collected very quickly. Never could have been done any other way.
Yeah.
It's interesting. If I can quickly add to that, the paradox, though, is that there's humanity inside of that, too. And what I mean is, to use myself as an example, they put my birth date wrong when I went to get vaccinated. And we have had a difficult time actually getting me on the official books as vaccinated. And I don't receive the notifications on my iPhone that my partner does. And so it's just interesting how the system is so beautifully built, and yet it still has its human errors that we need to find a way to, you know, source, okay, what do we do in that human element?
Yeah.
Wow, it's
So
great.
I'm actually very encouraged by the sort of next wave in technology. Jeff, when you were talking about, you know, a physician buried into a computer, you know, I can tell you lots of physicians hate the electronic health record because they feel like that they did their training to see people, not be data entry operators. And the next wave of technology is going to take that away from a lot of us. We're working with a company right now that just as we're doing this on screen, it actually monitors the interaction and writes the note for you. How about that? You know, you review it to make sure it has the things that you wanted there. And then during the pandemic, we actually got a digital front door where people can just like get access to care, their appointments, those sorts of things. And if people allow us, you know, if we have their permission, we can monitor their social media. And the technology with AI, artificial intelligence, is sophisticated enough that we can know when people are getting into difficulties and trouble and intervene. And a part of healthcare is monitoring how people are doing. And right now we do it in a very kind of crude way. I will bring you in over and over again to see how you're doing. But if we can leverage technology that helps me know you're doing just fine, or it's time for me to reach out to you, that's going to expand our capacity a lot.
Yeah, a great point. Anita, if you could also elaborate also on the technology, how it's being used to be resourceful to people in the workplace, in the case in your company, how that's educating people to use the technology to be, to take more proactive measures towards their own well-being.
Well, I mean, not so much in my company, but what I have seen in a lot of organizations are people are using kind of technology to help people monitor, all sorts of things. We know that people are monitoring their diet and exercise and sleep. The extent to which people are using those kinds of healthcare provider partners on to help kind of manage day-to-day stress, to kind of reflect on health and well-being, to be kind of a proactive partner in their own health. You're starting to see these kinds of mobile aids and apps and the like. So in the early days, it was a lot of how can we think about just kind of the deficit model of health. And now there is more kind of proactive investment kinds of tools that are being used to help kind of track routine health and well-being. So it's very exciting. I mean, certainly we're also in the well-being kind of measurement space. We're doing better at both organization and city levels to monitor, human sentiment and the mood of a community using social media data and other data as well. So there's an opportunity to get ahead on what's happening in an organization, in a company, as well as in a community. So that's also very exciting as well.
Great. Well, thank you, everybody, for shedding some valuable insight on the first question. We're going to move along. Let's say as a person with limited money and time for treatment, how can a layman utilize technology for his or her well-being? So if we're talking about limited resource or limited money, time, people may be working too much, they don't have the time. What would you recommend, how can they utilize this technology to better?
I think if we go back to this point of many people around the world have a mobile phone, a simple fitness tracker is probably a good introductory way to begin to understand how are you feeling, how are you doing, are you getting your steps in, are you feeling stressed? None of these things are going to be the end all be all. I think it's also interesting that when people are using these kinds of tools, they seem to build some real camaraderie with other people who are using them, whether it's sort of a group of people at an office who are kind of having a little competition, or, over the internet, you have a community where people are discussing these kinds of things. I don't think they kind of get us to the same point of, if you don't have enough money to afford these things, or if it's other parts of the world where they can't afford them. But I think at a midterm level, I think it's a good introductory to a technology that helps with wellness.
Great insight, Jeff. Anybody like to elaborate what Jeff stated from your perspective, or any other resources you can draw from?
I can add a completely different, though I love Jeff's perspective as well, a completely additional perspective. So given that someone who is looking for information, especially if there's actually something wrong with the person, they're ill to some extent. We know that if they go hunting on the internet for information, they're gonna, nobody wants to WebMD themselves. That's really not a good idea, right? The alternate possibility, though, is when we focus on our emotional health, obviously to a degree, we don't want to bypass something that's really wrong and not see the doctor when we need to. However, when we focus on our emotional health, the physical, the mental, it all starts to come in alignment. And there are a lot more resources out there, free resources for mental and emotional health than there are physical, because a doctor can't diagnose someone over the internet. Someone who does deep emotional work can write a blog that might actually get you somewhere. So when in doubt, I would recommend going to the emotional health first, as well as the mental health. And that will also help to kind of clear out the space inside of you so that if you need to seek help, the opportunities will start to appear.
Got it. Great. Dr. Clark or Anita, like, I mean, when Jordanna talked about mental well-being, I always look at the 8 pillars of wellness. You know, if you address your emotional well-being, is that going to affect your physical well-being in a positive way? Of course, it could affect your relationship with yourself and others, shifting away from codependency to interdependency. It could affect your financial well-being, your spiritual well-being, your occupational, intellectual, and environmental, you know, finding that harmony. Anita, to Jordanna's point, there's a lot of resources through EAP providers, especially around mental and emotional well-being. Is that a good starting point, Paz, from your perspective, to educate through resources to create awareness how people could take more control over their well-being, especially when there's a limited time and limited money on their part?
Yeah, I mean, if people are fortunate to have access to those resources, and certainly in the US and countries that are kind of economically developed, that would be probably a good start and a way to go. But again, I mean, I think as others have cautioned, technology also can't be a Band-Aid for kind of a health infrastructure that is failing people fundamentally. And I think that's where the Sustainable Development Goals have been trying to put their focus. Another just perspective, though, on how technology can be used when we're talking about some of the things that the UN really was thinking about, was also crowdsourcing information about the health of your community. And so people have used technology in a citizen science way. And so if you think about people who are advocating not just for themselves, but also for their communities, that's just another perspective on the benefits of technology. So definitely, if we're talking about emotional health and you have access to kind of EAPs and other kinds of programs, great. But in the broader health and well-being sense, I think that there are some major structural problems in health, both in the US and globally. And there's a benefit of using technology to actually tell those stories of one's community as a policy or advocacy tool.
Thank you for sharing that. Good insight there. And Dr. Clark, would you like to elaborate on anything Anita said to Jeff or Jordanna share?
Well, yeah, a lot of things. So Anita, I appreciate your bringing up that people around the world have phones. And I think we have to have some good public policy discussions about how to get people access to really good information through the devices that they have. We know about, especially in the US, lots of people have wearables, but the GPS technology in our phones, even very old phones, can give us a lot of information about people's overall health status. What we haven't done anywhere on the planet is really put the resources towards people's well-being compared to the need. So if you compare any country on the planet, the need for sort of well-being, mental health, substance use disorder treatment is huge. And yet everywhere on the planet, we put this much resource to it. And the problem is that it has an impact on people's overall health in every aspect. And if we can get to the point where we can continue to have these conversations that have started about being able to talk to one another about how somebody is doing. You don't need to be a diagnostician, but all of us can say, what happened to you? Not what's wrong with you, but like what happened? And someone's like, what do you mean what happened to me? It's like, you're usually kind of cheerful and full of energy, but lately I haven't seen that at all. Like, what happened? And people have a story. And you don't really even need to know what to do, but to listen to somebody's story and to say, you know what, I would get some help with that.
Any other final points that we'd like to share as to this question? Thank you for sharing, Dr. Clark. Any other final comments to this question? Okay, well, let's look at, the pandemic has proved that technology can be of great help to achieving good health. How do we stabilize and strengthen the bridge between medicine and technology?
I mean, I think we have to have some kind of structures in place. Others talked a little bit about the growth in telehealth and telemental health and the like. And for many in that field, they've been excited that finally people might be utilizing this resource. Had a lot of promise a few years ago, but still it wasn't being discussed. And one of the challenges is how we pay for it and how we support it in the routine delivery of medical care. And there's really very little that is making it sustainable right now. And so there's a lot that just needs to be done, roll up the sleeves, get it paid for, get it kind of part of the continuum of what is healthcare. So I think even though that doesn't seem very exciting, if that doesn't happen, people's use of technology in that way, providing access to care, will become less prioritized when the pandemic subsides, because we tend to go back to old patterns. So that's a low-hanging fruit, but actually a pretty important one.
I actually think that's a phenomenal point, Anita. I think the consumers, and I assume consumers around the world, I think really love telehealth and access to a limited number of mental health professionals physically, but having access to be able to see people who are, more than 10 miles from where you live because you have telehealth. And I think the gatekeepers of that technology, is payment, it's insurance. It became available through the pandemic because, the restrictions on whether that could be paid for went away. And I think most people probably hope very much that the payers are willing to continue paying for telehealth and and especially telemental health once the pandemic sort of moves a little bit to the distance. If we go back to, it'll be a real shame if we fall back to the old patterns and aren't able to convince the powers that be to maintain the programs that we've had during the pandemic.
I think one of the big things that that weakens the bridge between technology and wellness is how quickly we want to act on things. Like when I was in social services all those years, I noticed many failed projects that were failed because they would take a start without really the resources and the fuel that it needed. So if you think about the way creation works, like if you ask a mathematician or a scientist about Fibonacci sequence, which is how nature grows things, it grows things very slowly with a really solid foundation. And so I think it's up to us, the humans building the technology and incorporating it into wellness to figure out what that solid foundation is. So when we embark on a new project in a new community, like what resources do we need to ensure that the project's foundation is actually built with solidity so that when it scales, it actually serves instead of being this beautiful piece of technology that actually is harming people or at best not doing much.
Great. Anybody like to elaborate further? Dr. Clark?
Well, I think we have kind of a funny thing, don't we? We spend way too much time on these phones here, right? Like you can even monitor your screen time. And now we have healthcare saying, hey, just do just a little bit more of it. And so I think along with the technology, we need to look at what are the skills that people need that actually get them away from these phones. I don't know about your sort of death scrolling, but I have gone down the black hole here many, many times. And it's like, where did the time go? Was it satisfying? Not particularly. So it's things like, instead of that moment of boredom grabbing your phone, you have a list that's there beside you that says, what are all the things that I can do that don't involve a screen? And getting out in nature and taking a walk. And so I think as we utilize these technologies, we need to also look about balance and how do we get people not using the screens also.
Yeah, I think that, that harmony, technology is great, but like you said, we can, because of people's capacity to overdo things like addictions, we can become addicted, we get bored, we get sucked into these voids of time spent on things that really are not serving us, that can actually be working against us. So it's using the technology wisely. Would it be safe to say that plan, like, have a certain times during the day, and be very strict to those times that you spend on there if you're using it for the information that can help you, in this case, in enhancing your well-being, not digressing it.
Yeah, I'm a big proponent of this concept called time blocking, where you actually block out your day, and it's sort of like, this is when I'm going to go for a walk, and this is when I'm going to, see people in the clinic, and this is when I'm going to do all that paperwork that brings the money in to keep my healthcare program going. So in teaching those skills, I think we could actually start much earlier. I would say that more of the talks that I did during the pandemic was just about how to handle stress, because people felt stressed out, and they're very basic things that each of us can do to help with stress. And we don't teach those. I think it should be part of the curriculum that we teach children in schools.
Yeah, I agree. Would anybody like to elaborate? 'Cause I'm a big advocate of, not only stress reduction, but providing life tools. I mean, things that we tend to get caught up in, the things we cannot control. It's like, I like to think of it like just change how we think. We're always conditioned to get caught up in the things we can't control, to resist challenges, to avoid challenges rather than embrace them and trust that process. Anybody like to elaborate on that? I think that's really an important point when you look at well-being overall, when we could learn how to just control what we can in the moment and be more present rather than in the past and the future.
Well, look at any health education curriculum in secondary or primary school, and it's mostly, a traditional way of thinking about health. It's mostly disease avoidance. It's less about kind of the interconnections that we know matter for well-being in terms of how people have a sense of purpose and have a sense of harmony and a sense of service and all the things that we know matter in subjective well-being, and in terms of that kind of mastery and that sense of engagement. And there's none of that we really teach either in those kind of health education classes, in curriculum, then modeling, and all the ways that we invest in that. And so the extent to which that becomes embedded in all of our processes in child development and beyond, I think is a big step. And we tend to conflate some of that health thinking, like healthy lives, exercise, food, what have you. Not that that isn't important, but we miss the beat on some of the other dimensions of well-being, and we make it clinical, or we make it deficit-based when that's really not the intention that we're seeking. And then we wonder why people don't have hope, that don't have a sense of resilience, optimism, all those things that matter in well-being. It's really a function of where we put our investments in terms of time and money. So we've got to kind of unpack and dismantle a lot of the ways that we educate and model for certain.
Yeah, I agree. Anybody like to elaborate on that before we move on to our final question of the evening here? Or
there's one piece that I would love to add. As far as teaching children goes, asking big questions is really important. And it's something that kids have really been conditioned not to do, because their parents are generally afraid, or the teachers are afraid, if they ask big existential questions, are they going to become suicidal? But it's actually the opposite. Right? Like if we look at growing suicide rates, a lot of it is because these kids have huge existential questions. And because we all have purpose on this planet, like they want to unpack them. And so the more we add that allowance and that capacity into the classroom, the healthier kids are going to be. Because humans, we're supposed to have big questions. Like here we are discussing the possibilities and discussing our big questions. And I think it only stands to reason that kids want to do that. And when we give them a platform to, they become a lot healthier and more stable.
so, Jordanna, would it be safe to say by sharing, it's better to share and to empower kids to be part of the asking questions, being part of the discussion rather than just telling them how, when, or why to do something?
Yes. And it is like, again, if you look at creation and the way nature grows, the the younger life tends to actually know more than the older life. Even though there is a lot to be said for wisdom and experience and the experience of our elders, there's so much to be said for it. There's also a lot to be said for the wisdom of youth. And kids yearn to be able to express that. So yes, like instead of just telling them, leaving the platform open for them to ask questions and be in the conversation and even add in their 2 cents.
Great. Jeff, would you like to add any feedback or any other viewpoints on this?
I was just going to add that I think this is another place where technology can really play an important role, especially for younger people. I mean, people are used to shorter sound bites and getting their information through technology. The days of teaching health from a textbook in over the course of a school year versus being able to do storytelling and using digital technologies to be able to encapsulate a message into something that kids can understand in a way that they can understand it in a short time frame that they have to listen to it. I think technology is really going to play a role there. And you can see now the amount of people who are really building storytelling skills. And even if you look in consumer products and industry and business, big jobs are people who can tell a story through technology and media in a short soundbite. And I think that's going to probably have to find its way to healthcare education in the schools so that students can absorb the information in the way they've become accustomed to receiving other information.
Yeah, I think that's great what you said, in shorter doses for retention and engagement. People only have an attention span of so long with information. If they're able to absorb this in smaller doses, they're more likely to retain and perhaps utilize it more to their advantage. Great. Well, we have our final question for here today. We're going to talk about, the question is, how can the Internet of Things with devices and online be useful in maintaining perfect mental health or overcoming such problems? So we're looking at the Internet of Things with devices and online. How can it be useful in maintaining, I like to say in this case, a ideal mental state of health or overcoming such problems?
Well, I mean, the Internet of Things and the Internet of Bodies also speak to the kind of interconnection of all of our devices, and that can go horribly right or horribly wrong, right? So if it's kind of asynchronous, I think you have a lot of outs in terms of getting overly saturated with technology or having kind of different signals about your health and well-being. But if there's a way to kind of create some harmony across that connection, it could be a net positive, right? It could kind of reflect some of those values that we've been talking about over the last hour in terms of well-being. The other piece of it is the extent to which people are accessing that data, right? So we're hyper connected. You can connect to your car can connect to your phone can connect to your medical provider. Some of that can be useful data that really tells people who are helping you with your health about your behaviors and actions. And that can be a positive because you can get a more fulsome diagnosis. On the other side, there are huge kind of privacy and security issues. So I think those are some of the least the issues to sort in kind of a hyper-connected technological environment where lots of places have your information. That can have pros and cons.
Great, Anita. Anybody else like to share?
There's an irony. Oh, I'm sorry.
No, go ahead.
Somebody
please.
else wanna? Okay, cool. So there's an irony in wellness when it comes to technology, which is kind of an irony / paradox. We use technology with the mind. Like when we connect to an app, really our mind is going into the app. And this is part of what cultivates addiction, is that we lose track of our bodies. We lose track of our feelings. And so though I don't have an answer, what I would say is that the more we can design apps that help people connect to their bodies for the sake of wellness, or at least teach people how to stay in the okay, you're here on this app, but are you really here? The more we have programs or other apps or ways to teach people that, the less they'll get lost in the dark side of the technology and the more they'll actually be able to benefit from what they're being offered.
Yeah, I think the $64,000 question is still, the answer is still out there. I know that looking at your phone right before you go to sleep and looking at your phone the moment you wake up can't be good for us. And figuring out how to resolve that by, keeping your mobile devices and your gadgets somewhere else, or having your first cup of coffee before you enter the world of, before you enter that world. I mean, I think whoever figures out how to really find the value here of how to use these devices and these websites and these apps, because I personally know deep down there's value to be added through support from my technologies and my mobile phone, but I also think it's very easy to fall into the sort of the black hole of it all. Yeah,
good point, Jeff. Even what Dr. Clark said, it's one of those things that comes down to discipline. And, discipline is something that requires repetition, something you do every day in order to rewire how we think, to do things in a different way, to become, to do, and have different results. Because, people will always default back to those patterns until we get into a rhythm of doing something better. Like you said, waking up and your phone's not in your bedroom. It's somewhere downstairs, and you're not going to go look at it for another hour because maybe you're meditating, you're journaling, you're making your bed, you're having your morning cup of coffee, you go for your workout, then you come and you can check your phone, and and having some other type of routine before you go to bed to relax and so on. So anybody else like to elaborate to Jeff's point and to Jordanna on that? Dr. Clark or Anita?
Well, I would say that the Internet of Things can be a double-edged sword, right? It can be helpful to us. And at the same time, we can get lost in it. So, for example, I know that one of the problems that we have in the US is that we don't get enough sleep. We don't. And if you practice getting enough sleep every day for a week, you will be surprised how much better your well-being is. So I actually use my technology to remind me to go to bed, right? Because I get so caught up in things, and that's an example of doing an intervention where the Internet of Things are monitoring how much I'm sleeping or not sleeping and giving me feedback that I can do an intervention that I know will actually be helpful to me. We will see digital therapeutics in healthcare where people are being monitored either by their phone or the Internet of Things, where people will get helpful information about what they need to do. It may be even things like shut off the screen and go outside for a walk. That sort of thing. Now, you may be wondering why I have plants in the background here. One of the things that we get taxed with in our everyday lives is our attention span. And the attention restoration theory is really quite good about the impact of nature on restoring our ability to concentrate. And it works great if you're outside, but it also works if you're just looking at scenes of nature. So I think as this sort of, technology is a part of our lives, it's going to be here for the rest of our lives. How do we learn those skills about letting it be an adjuvant to our life and not a deterrent?
Great, thank you for sharing. And Anita, would you like to finish off on this question?
I'll just add, because we started off a little bit with the health and well-being goal or the sustainable development goals. A lot of that was rooted in making sure that we had communities that really have access to health and well-being and kind of the roots of health and public health. And so a lot of what we're talking about in technology is kind of where the roots of public health were, which were in hygiene. And having kind of structures and expectations for our communities around how we, took care of each other and certainly how we took care of early diseases. So technology kind of has that piece to it. There's real opportunity. It can create structure. It can create real supports for our lives. but it also requires, essentially good hygiene. And right now we don't really have a kind of a code of conduct and a code of ethics around technology. And we certainly don't have a code of ethics and conduct around health and technology. So a lot of what we've been talking about today, shows great promise, but there's not yet those standards for how we are going to use it and how we're going to use it in a healthful way. So hopefully there's a lot of hope ahead, but we've got some work to do, I think, to make sure that this doesn't get misused in ways that other kinds of health tools have gotten misused in the past.
I think also one final thought is, if we really want to drive good health and well-being around the world, we have to increase the capacity of healthcare providers, right? And we have to drive down the cost of healthcare. And sort of a key question is, can we move the technology beyond some of the things we've been talking about to purely drive down the cost of providing this healthcare in a way that, I know it's more expensive in the United States than in other places, but can we drive down the cost so more people can afford it? And is there a role for technology to play to help make that happen? I would say yes, and we have to sort of concentrate on, what does that really mean? We have to be paying our healthcare providers to provide their services, and we have to take out the fat and see if technology can help to do the operational things, at a lower cost. So I think there's a role for technology to play there. We didn't spend much time on it, but it's probably very important.
I agree, Jeff. That could be another panel discussion at another time, which I think is fabulous and something we should definitely elaborate on. I know we run out of time here today, but thank you, all of you, for taking time to be here as part of World Kindness Day. When we look at achieving universal health through technology, this is such an important area that's constantly evolving and just requires more masterminding like we kind of did here today, sharing some insights and how we can make those improvements over time to make this technology, work in our favor and really enhance and take our well-being to another level. Thank you for everyone for being here. And we want to thank you all for listening here today. And we wish you a great World Kindness Day. Enjoy yourself, and we'll be back for another episode in the future around well-being and technology.